Week number 2, lecture number 1.
Hello everyone.
Hello friends. I'm happy that you are here with us in second week. That means your journey has started. I request you please continue. You will enjoy this. And it's a very short journey of just 12 weeks. But the knowledge which will be imparted to you in these 12 weeks will remain with you forever till you live, and I guarantee you that it will be very, very helpful to you, to your family members, friends, and society as a whole. Thank you.
In the week 2, we'll be talking about advanced communication skill, and it will contain 6 lectures on communication skill. Lecture number 1 will be what is active listening. Listening is very important part of communication skill. Without proper listening, you cannot answer the questions of the patient and you cannot satisfy him about the information you want to give.
You see, I want to tell you that most of us are very, very fond of talking, but we do not listen properly, and therefore there are so many errors are being committed. And particularly in medical field, we cannot pardon such errors because it can take the lives of some patients. Therefore, active listening is very important, particularly for medical professionals. Whatever is being said by the patient and relatives should be understood properly and should be acted upon by health professionals. Are you really listening is a sort of, it consists of number of tips. Like I want to ask you, are you really listening us? So all those questions are being tackled in this particular sessions, and at the session I'll ask you the same question. Did you listen to us properly? Even after this introductory lecture also we'll ask you the same question.
So listening and adequate listening, active listening will bring success to people. That is for sure.
Active listening skills. Now 2 words I want to tell you very briefly: qualities and skills. Qualities are basically, they are inborn. They come with us when we take birth. It is not to be taught. But skills can be learned, can be practiced, and it can be learned from a proper professionals. If you say, what is quality, means me, who am I, that is my quality. And when you ask a question, what means, what should I learn so that I become a successful person, that is where qualities and skills will come up in our teaching process. Here in this lesson we'll tell you about certain active listening skills, and I'm sure after the end of that lesson you will be a good active listener.
Lecture number 4 is for communication skills among healthcare providers. So the healthcare providers can be a doctor, a nurse, a paramedic staff, a social worker, a counselor, a psychologist, or a volunteer. So the whole team has to learn communication skills, and this communication should be uniform throughout this group of people. One person will say something else and another person will contradict it. That should not happen. So to learn a proper communication skill, and that too in a group amongst the health providers, is very, very important.
As we said earlier, health providers does not mean only healthcare providers of hospitals, that is doctors, nurses and paramedical staff. In palliative care, even the family members, the friends and other caregivers, they are also healthcare providers. So this particular lecture is very, very important to all of us.
Next lecture is communication competency in health professionals. So health professionals should have a competency in communication skill, and at each and every stage they will learn something new when they talk to another patient, then another patient. So communication skill can be learned throughout their professional career.
When we talk about communication competency, it is a private property. Private property means everybody, each and every individual should be able to speak confidently, precisely, and correctly. That is a private world, and this is very much required in health profession. Even it is required in social life also. So here we are going to talk about communication competency, but it is connected with all of us in civil life also.
Lastly, in this lecture, in the session week 2, the last lecture is talking about death. We never talk about death in our society. Death is considered as a taboo, but it is inevitable part of our life, and we have to talk about it. And particularly in palliative care setup, when patient is in terminal phase of the disease and he is likely to die, you have to convey these things to the patient, for the carer, for the family member, for the friends, and many other people. So how to talk about death, a very difficult subject, is taught in this lecture.
Thank you, friends, and please continue for our next week also.
Let us have theme for this week.
Yeah, I just forgot. What is the theme? Can you tell me, all of you? Can you think about it? We basically discussed about communication. So the theme is communication is the key to palliative care.
Wonderful.
Let's repeat it. Communication is
Communication is a key to palliative care.
Thank you. Thank you, friends.
Thank you, everyone.